Hello and welcome to the launch of Ipsos MORI's new Qualitative Research and Engagement Centre. I'm Kelly Beaver. I lead the Public Affairs division within Ipsos MORI, which is a team of around 300 social scientists who work with governments in the UK and overseas to solve social policy and economic policy problems using the full range of social science disciplines. Today, we're launching the Qualitative Research and Engagement Centre, but this isn't because Ipsos MORI has only started doing qualitative research and engagement. In fact, we've been delivering this kind of service for our clients for over 50 years now in the UK and for nearly 20 internationally. But what it does do is it marks a very specific milestone in our evolution of engagement methods and as a business and as a team. This centre brings together all of our specialists who work in both qualitative research and public engagement as a centre of excellence, which will innovate, drive forward improvement in the areas in which they work, be creative, and release lots of useful thought leadership to those others working in both policy and practice around qualitative research and engagement. So today I'm delighted to bring a range of experts together, including some of our own. And if you go to the next slide, please, you can see who you'll be hearing from on this webinar today. So firstly, Michelle Mackey, who is the leader for the Qualitative Research and Engagement Centre, also known as QREC, because we do love an acronym at Ipsos MORI. And she will be joined by some of our clients and some of our partners who've worked with us over the last period in order to deliver public engagement activities. We have Amy Darlington, who's an Executive Director at Imperial College Health Partners, Nick Hibbert, who's Executive Director of Economy, Environment and Cultural Services at Brighton and Hove City Council, and also Margot Coolan, who's a Research Assistant at King's College London. Today, we also released a good practice toolkit for public engagement, and each of our experts will talk to some of the principles that are within that toolkit. At the end, you will have an opportunity for Q&A, and please do put your questions in the chat function, and we will get an opportunity to come to them. But for now, please let me welcome Michelle.
Thank you, Kelly, and hello everybody. I'm Michelle Mackey. I'm a research director. I've worked in social research and social policy for 17 years now, and for the most part of that, I've been working on qualitative research. So as Kelly said, this isn't a new methodology that we are introducing to Ipsos MORI, but what we're doing through this new centre is we're bringing together our experts in qualitative research and also our specialists in deliberative engagement. And what this means really in practice is that we can continue to respond to our clients, to their needs, and design studies using the right methods and the right approaches to answer their objectives. So we've chosen to focus today's seminar on our deliberative engagement, and as Kelly had mentioned, we have launched a best practice guide today, and we've invited a panel of experts who have commissioned Ipsos MORI previously to conduct deliberative engagement. We want them to reflect on their experiences of commissioning these projects and for us to think about what this means for going forward. And so the next slide shows what we're doing today, which is bringing together our two teams. And if we can move on as well. So just to say that some of these examples are very recent examples, and you'll hear about some others of ours during the talks later. What we've done here is shown you a selection of studies. On the left, we have deliberative engagement. So for the Royal Society, we were commissioned to do a public dialogue focusing on the values and priorities of the UK British public in relation to land use. And below that, Oxford City Council. So Oxford commissioned us to do the first UK climate change assembly at a local level. So it was the first local authority to involve its population in shaping its climate change agenda. And on the right, we have some examples of some qualitative research using innovative methods. So for the Centre for Ageing Better, we used digital ethnography to bring people's experiences of later life during lockdown to life. And below for which, the consumer group, we used digital ethnography to show people's experiences of finding a home in the private rented sector. So these are examples of some of our work in recent years. And if you move on to the next slide, I can talk about the best practice guide. So today we are launching our best practice guide, and we will post a link in the chat so that you can go on and have a look and download it. And what we really want from this guide is to share with you our learnings and our experience of delivering deliberative engagement over some time now. We want it to be an accessible, and we hope it will be an accessible, usable, practical guide which will help those commissioning and also thinking about commissioning deliberative engagement. Deliberative engagement is a very important method, and particularly as we go through and come out of COVID and as we approach recovery. And we have some big social and ethical dilemmas to think about together as society. And this methodology can be really powerful in bringing the public voice into those decisions and involving our citizens in decision making. So the best practice guide is available as of today, and we really hope that people find it useful. So what we'd like to do now is introduce our speakers. So each of them are going to speak to some of the principles within this guide, and every one of them will cover the first one, which I would say is arguably the most important, defining a clear question. So I'm really happy to hand over now to Amy Darlington, and then we will hear from the other speakers in turn. Thank you.
Thanks, Michelle, and hi everyone. It's really great to be here today. So I'm Amy Darlington. I'm an Executive Director at Imperial College Health Partners, and we're a partnership organisation that supports complex change across health and care systems. Predominantly we work in London, but we also do some work in other parts of the country and internationally as well. I was also the engagement lead for the One London programme, which I'll talk to you a bit more about today. And it's one of the case studies that Michelle and Kelly has asked us to talk about. So what is One London? Well, One London is a programme which aims to connect and join up all of the health and care records across London's health and care systems. So that's around a population of about 9 million people. It won't be a surprise to many of you to know, and I'm sure you've experienced it yourself, that often when you have been at a GP surgery and then you go into a hospital, you often have to repeat your story because the hospital clinicians can't see what the GP see and vice versa. And this is a real challenge for patients, but also it's a real challenge for healthcare delivery in the NHS. And by bringing health and care records and data together, it means that not only we can improve direct care or the care of the individual, but it also means that we can realise a whole range of other benefits around planning, around transformation, and also indeed how we use data for research purposes. So there are huge benefits, and that really is what the One London programme is aiming to do and has made great strides over the last couple of years in that ambition. But we were very clear from the start of the programme that we didn't want to repeat the mistakes of the past, and it won't be a surprise to any of you on this call that actually the use of health and care data is quite a complex but also often controversial topic, and I'm sure you will have read about the GP data set for use in planning and research recently, or GDPR as the acronym has been termed. And this has really kind of proven just how important it is to engage the public in these types of matters. As I said, there are significant benefits to be realised from using health and care data, but actually the fact that we might be using it in a lawful way, or that there's political willpower to make sure that we're using it in a certain way, often we can assume that that gives us the legitimacy to use people's data. And actually, I think we've learned in the past and also again recently that that isn't enough. And we need to be working in partnership with the public to really understand what their expectations are in terms of how we use their data and how we do that in a way that is trustworthy and has their confidence. And so when we started One London, we wanted to really have a meaningful and open and authentic conversation with the public. We wanted to expose the benefits. I think we're very good at telling people what the benefits are of using health and care data. We not so much kind of talk to people about what some of the downsides or risks of that might be. And we wanted to be very honest about the benefits and the risks. We also wanted to invite them to grapple with some of the trade-offs and dilemmas that, as decision makers and people responsible for developing policy in this space, that we were facing on a daily basis. And we wanted to invite the public to work with us to understand and explore some of those trade-offs and understand how they weigh up those benefits and risks. And importantly, doing this in the context of reality. So Too often, I think, and certainly this is the case in the NHS, too often engagement looks at a moment in time and isn't so honest about what constraints or parameters we're working within. And that can often lead to sets of wish lists or recommendations that aren't feasible or able to be implemented, and therefore they're not helpful to decision makers. And they might be, you know, really great insights, but actually we can't do much with it, and therefore it's an output as opposed to an outcome. And if you are therefore clear with the public about what the constraints and limitations are, it means that actually the insights and the expectations that we gather from these types of exercises are really helpful, and it means that they're much more likely to be implemented and therefore actually be able to develop that trustworthy policy, which was the ambition. So in One London, we chose deliberation as a method. It wasn't the only method of engagement we used, but it was the predominant one of our engagement programme, to really have this discussion with the public, to enable them to explore the trade-offs and to do that within the context of constraints and the reality that we were working with within the NHS. So what did we do? Well, we worked with Ipsos MORI to deliver a large-scale deliberation. We brought 100 Londoners together, reflective of the broader population. So not only in terms of ethnicity, of age, of gender, or socioeconomic status, but also we undertook an attitudinal screening as well, as with data use. You have different perspectives and different attitudes, and we wanted to make sure that our group captured all of those different attitudes, and we had that diversity of view as well. We brought these 100 people together physically. It feels so weird to think about that now, but we brought them together over 2 weekends, literally just before the pandemic hit. So it was in February and March last year, early March last year. So they spent 4 days together. And that is a lot of time invested in terms of them hearing from experts, learning about the complexity of how we use data, store data, access data. And over those 2 weekends, they worked really, really hard and developed a set of recommendations that are actually still being used today. So Michelle and Kelly have asked us to look at actually some of the principles that are in the newly published guide, and just to talk about how we went about implementing some of those principles within our own work. So I'm going to talk about particularly 3 today. So the second principle, which is around engaging people at the right time and taking enough time. So this was a long process for us in One London. It was 9 months in design and delivery. That's, you know, a significant amount of time, but actually it was probably even longer than that in reality, because before we even commissioned Ipsos MORI to support with this work, we spent a good 6 months probably paving the way, lining up stakeholders, gaining support, and actually building the case for investment in this important piece of work. I can't kind of stress enough how important it is to take the time to do this. We had an independent advisor working with us who was an expert in deliberation working over in Canada. And when I originally showed a timeline of a few months, he practically laughed me out of the room. It's like, you need to rethink this. And often we have decision makers and policy makers saying, right, we need to make decisions now, we need these insights now. And it took a lot of work to help people understand that we can't do this quickly if we were going to do it right. And so a lot of time invested in it. That said, more recently I've worked on deliberations that have been shorter, so it is possible, but this isn't something that you can do in a matter of weeks. You know, it still takes a couple of months, but and that can be quite intense. So thinking about how much time and making sure you've got time for planning is something that's really important. Principle number 3 in the guide is around ensuring stakeholder buy-in, and that you are dedicating time for stakeholder engagement. For me, and in the One London programme, and probably in other deliberations that I've supported as well, I think this is as important as the element of engaging the public. None of us want to go into a deliberative process thinking that actually it's just about designing a set of outputs. Actually, we want those outputs to influence decision making, to influence policy, and the only way that it's going to do that is if you've got a set of receptors, or people that will receive the recommendations, will receive the outputs of the deliberation, will take those on board and will help and use them to shape policy and inform decisions. So actually the legwork that's needed to really get people engaged in the process, getting them supporting the process and being active participants, not in the deliberations themselves, but in designing the materials, in participating as experts in the sessions, and in receiving the outputs is really, really critical. And we invested a lot of time and effort in this during the One London programme. And actually that has led to the outputs that the public produced as having real influence and impact. And these 100 people worked so incredibly hard over those 4 days. And even now, over a year on, their work is still being used. It's still being, it's influencing not only policy in London, but actually nationally, and has been recently quoted in the National Data Strategy for the NHS. And the last principle that I will just talk to, and then I'll let others come in, is principle number 9, which is around transparency of the process and privacy of participants. So I think kind of by the time we'd spent so much time engaging with stakeholders, we'd spent a lot of time planning this process. We'd had an advisory group that were overseeing it, and by the time we got to the events themselves, as you can imagine, there was significant interest from people, not only stakeholders in wanting to attend and observe and see these discussions for themselves, but also the media who were quite intrigued by this process. This wasn't a process that's been used a lot in the NHS and in health and care, and this was something that they were quite fascinated by. And we had to be really mindful actually about how we protect the privacy of the participants, of the people that were giving their time to this, and that we enabled very safe and open discussions. So we were very considered around which media we invited into the room. We actually only had one journalist in the end. They were selected very carefully. It was only on background briefing only. They weren't allowed to report on anything. They had to sign an agreement to that effect. We filmed a lot of the presentations and the sessions themselves. We'd actually considered doing live streaming because we wanted it to be a transparent process. But again, we were worried about the privacy. So we decided to film presentations, but making sure that anybody that didn't want to be part of those videos or indeed photographs were clearly identified. So we put red dots on their name badges so that they were, again, their privacy was protected. At the other end of the spectrum, though, we had a real ambition for this to be a transparent process, and we knew that actually the more transparent we could make it, the more scalable the impact would be. So we made sure that we published all of the materials that we shared with the public. We filmed all of the presentations from our experts and our panel discussions, and we've published, and it's still available today, we've published all of that online. People can download it, can use it, can edit it and change it and use it in their own engagement discussions. And actually, that's been really, really helpful in maintaining the legacy of this work, that it's not just been a report that was published last year, but actually people are still using the assets, still using the materials. And that's meant that it's had huge impact and is still having, as I say, huge impact today. So I'll pause there. I'm sure I've gone over on my time, but hopefully that was helpful.
Thank you so much, Amy. It just explains and demonstrates how challenging it is to get this right, but it can have a huge impact if we do. So thank you for your input. I'm now going to welcome Nick Hibbert. Nick is going to talk to us about Brighton and Hove's Climate Assembly. He's the Executive Director of Economy, Environment and Cultural Services. Nick, thank you so much for joining us. And you're going to reflect on principles 5, 6 and 7.
Yeah, thank you, Kelly, and hello, good afternoon, everyone. So I'm going to talk a bit about the Climate Assembly that we delivered with Ipsos last year in Brighton and Hove. Just before I start, a little bit about Brighton and Hove. So, I mean, you probably all know about Brighton as a city, but it's always been a city that's held its environmental values very close to its heart, being sandwiched between the South Downs National Park and the sea, designated as a UNESCO biosphere in recognition of the biodiversity of the city in terms of both its urban, rural and marine environments. But it's also a green city politically, and with a Green MP. And currently we have a no overall control green administration at the City Council. And I suppose the reason I'm saying that is that I think what that means is that when it came to considering how we engage the city on the issue of the climate emergency, we had to consider that quite carefully to ensure that we were engaging in a way that reflected the importance with which our residents place the issue. We're also known as the most activist city in the country, and often the discussions we have are not whether there's a protest each weekend, but how many protests there will be. And that activism reflects a real strong engagement in the city by our residents. Our residents want to be engaged. They want to inform the city's policy-making process. And often the public involvement section of our city council meetings can go on for hours, literally hours, with a number of residents wanting to come and engage in the democratic process. And therefore, it was important to us to hold a meaningful deliberative engagement process as part of our preparation of our climate change programme as we transition to net zero by 2030. We declared a climate emergency along with many other local authorities back in late 2018, and we started in late 2019 to work with Ipsos to design and deliver a citizens' assembly, a climate assembly. We initially planned for that to be a physical climate assembly, and it was going to happen in April 2020. Obviously, with the pandemic hitting, we then transitioned that to an online assembly. And we had 5 sessions of an online assembly over a period of time. As Kelly mentioned, I'm going to focus on 3 of the principles in the Good Practice Guide. And firstly, to look at, just before on those 3, we've all been asked also to reflect on the importance of defining a clear question. And one of the things that we needed to do straight away was to say, what is it we're actually seeking to ask the Climate Assembly? And one of the things that became, we recognised quite quickly, was that defining a clear question, but also a question that is not too broad, was really important from the outset. And I think in a city like Brighton and Hove, it's recognised that there's a climate emergency, and the city is very motivated to want to do something about that climate emergency. So therefore, it didn't seem appropriate to ask very broad questions. So we decided quite early on that we would focus on a particular area, and that was transport, and particularly as it was an area that we knew residents would be interested in, but also that it's an area that the City Council can do something about, because we own the transport network, we own the highways and the pavements, so we're able to have the levers to be able to take some steps. And we decided to define a question which was, how can we step up actions to reduce transport-related emissions in the city? And that we would use the output from that question specifically to inform the development of the city's new transport plan, which is what we're just drafting now. The next point was about ensuring that for us, that we were able to reflect the diversity of the city in our engagement. Now, we have an incredibly engaged city, but actually when the City Council tries to engage, we often find that we're speaking to the same people, because there's only certain parts of our community that are able to come to council meetings or to attend or want to respond to council consultations. So we wanted to actually make sure that we were reflecting the diversity of the city in our engagement, but also that we were giving people an opportunity to engage in this process that perhaps hadn't done before. And important to this was using an organisation called Sortition working with Ipsos specifically to handle the recruitment process. And this gave us a number of things. Firstly, it meant that we were able to stratify the selection process to reflect the demographics of the city's population. And we specifically included some oversampling of some minority groups in the local population in order to ensure better representation of the diversity of views within those groups. It also meant that the selection process was independent of the council, and that's important in terms of ensuring trust, so that people could see that it's not the council choosing who should be on the Citizens' Assembly. Sortition sent out 10,600 invitations to residents across the city, and there were over 700 responses, which I understand is quite a high response rate, so 700 registrations. And from that, the sorting the selection process took place to select 50 Assembly members that formed the Climate Assembly. And one of the most interesting points of the whole process for me was the moment that we first sort of pressed go on the first Zoom meeting, and we could see the faces of all the 50 residents that were taking part in the Climate Assembly. I've worked in the city for 25 years and always taken part in an incredible number of engagement processes. And I also live in the city, and yet I only recognised one face, and that was immediately to me showed that we were reaching out to a different section of the community from the people that we normally engage with, and that was really important to us. The second thing was to make sure that throughout the process that we could demonstrate that we were open to the scrutiny of the process, that we could ensure that there was the right check and challenges so that the integrity of the process and trust in the process could be developed. And that's in line with Principle 6 of the Good Practice Guide. And we did this by setting up an advisory body. And that advisory group was made up of different academics, politicians, people that are experts in the transport field, but importantly also activists. So we had members of Extinction Rebellion, for example, included within that advisory panel. So it meant that we got lots of disparate voices and perspectives, and they were able to provide the check and challenge when we were preparing for the Climate Assembly and between each of the meetings. So they looked at the structure and the content of what we were doing for each session. They helped us to identify and appoint the expert speakers that were involved in each assembly session. And it meant that we were able to really develop strong content, and they checked the content and commented on the content, the pre-reading, etc., that we sent out prior to sending that out on each session. The next point was that it was important for us that we could demonstrate that we were providing balanced information to the Climate Assembly on the different issues around transport that we were considering. And that needed to be done through people that could be viewed as expert speakers. So speakers that are from different specialist areas or different places from around the country, but also different types of people. So again, we had academics, we had politicians from other parts of the country, we had council officers, both from the city and from elsewhere, and transport operators, all carefully chosen to be able to provide us with, or provide the Climate Assembly with expert information for them to deliberate and to consider. And that's that sort of links with Principle 5 in the Good Practice guidelines. So overall, I mean, for us it was a massive undertaking to be able to do an engagement process of this kind online at a time when we were just also managing the pandemic. But we found it was an enormously valuable process. I think, like Amy said, the residents that were involved in the process worked incredibly hard and really gained an informed view. And as a result of the process, what we found was that the residents of the Climate Assembly really strongly supported taking action to reduce transport emissions, recognising, though, that making the wide-ranging change that you need to do to tackle something like a climate emergency is necessary, but it's also challenging. So one of the things that we really learned through this process was we learned a lot of feedback from them about how we should engage in the future and how you manage complex change and transformational and systemic change in the city, which is valuable to us not just in relation to the transport agenda, but in relation to any policy development or change that we're trying to deliver in the city. If you want to have a look at the Climate Assembly reports, then you'll see that each recommendation has conditions and caveats where the Assembly members were wanting to explain to us how we implement, as well as what we should implement. And some of their recommendations were really quite ambitious, including things like a car-free city centre, making public transport more affordable and accessible, having low traffic pedestrianised communities. So they really didn't shirk the difficult challenges. And we are now taking those recommendations forward in our local transport plans, with some of those initiatives now being delivered. So it's been a really worthwhile process for us, and the question for us is not whether we would take deliberative engagement processes again as a city, but when and what we would do next. Thank you. I'll pass back now.
Thank you so much for that. That was fantastic. And I think there's lots of learning there for other city councils who are certainly facing a similar challenge. And I think just the planning, but also the precision with which it was implemented was really interesting to hear about. So thank you for that. So now we're going to move on and introduce Margot Cullen. Margot, you're going to tell us a little bit about a project called Resource Allocation Age in COVID-19, which I understand to be a particularly emotive, deliberative topic. So thank you again for sharing with us, and I will leave it to you.
Hi, yes, so my name is Margot, and I'm part of a research team based at King's College London, which is called the Mental Health Ethics and Law Group. And basically, we are interested in the ethical, social, and legal aspects of health. And obviously, we've been thinking about the COVID-19 pandemic a lot. And as you all know, the pandemic has really overwhelmed hospitals all over the world. And at times, there were not enough ICU beds available to treat everyone who needed treatment. And in the spring of 2020, there was a real risk that there would be a shortage of ICU beds in the UK too. And there are also fears that a second wave in the early winter would again produce a shortage of ICU beds. And policymakers were discussing how to approach this issue, and academics were publishing papers on how to approach this issue. And we heard reports in the media that sometimes age was being used to make decisions about who to treat in such circumstances. And for example, in Italy, there was a hospital refusing to treat anyone over the age of 60. And we really wanted to know what the public thought about that approach, because policy decisions like that really directly affect the public. And we felt that they needed to have some democratic legitimacy. So we wanted to ask the public whether age should inform decisions about ICU bed allocation during the pandemic, and if not, what other approach should be taken by policymakers. But we did not just want to ask the public what they thought by doing a poll or a referendum. We really felt that this deliberative engagement was really important in this context, because the topic we wanted to discuss was so ethically complex. It's a really complicated question, and there are so many factors and implications to consider. So many people may have the intuitive response to this question that no, we should not use age to make decisions about resource allocation, because that's very unfair. But that approach has its own implications. If we're not using age, the decision of who to prioritize still remains. And approaches that appear to avoid the problem, so a lottery system or a first come first served system, may end up being extremely inefficient. And you could say that during a pandemic, inefficient use of scarce healthcare resources is also very unethical. So you're not going to get a good answer to this question if you don't take the time to really closely consider it. So we commissioned Ipsos MORI to organize a deliberative engagement study in London. And to prepare for that, our research team put in a lot of hours drafting materials to present to our participants. So we wanted to make sure that they had all the relevant information, and we outlined different ethical values and principles they may want to consider when thinking about this question, such as equality versus efficiency. And we also collated some relevant facts and figures, such as the correlation between age and survival chance for COVID-19. We ran those materials by the Ipsos MORI team, who prepared the discussion guides and designed the process of the deliberations. And we also provided those materials to external colleagues of ours at King's to review, just to make sure that the materials were clear, correct, and relevant. And their feedback actually made us reconsider a few times the materials we presented and the way we chose to present them to the public. In the meantime, Ipsos MORI recruited our participants, and they used purposive sampling, firstly, to make sure that the sample reflected the ethnic diversity of the area of London where we're based. And secondly, we also asked Ipsos to oversample participants over 60 years old, because age was such a central issue in our study, and we wanted to make sure that we included those people who were most directly affected by the things we were discussing. And interestingly, during our study, which was held remotely because of the pandemic, we actually found that a remote deliberative engagement made the process more inclusive for some of these participants. In particular, there were a lot of elderly participants who struggled with the technology, and they were then helped by younger family members. And when the participants' first language was not English, these family members assisted with translation as well. And so they were supporting facilitators in enabling everyone to take part in the deliberations. So that was a quite positive experience. In the end, participants agreed on a set of broad and very nuanced policy recommendations, although there remained a level of disagreement in the group. And these recommendations were summarized by the Ipsos MORI team in a report that reflected what was said during the sessions in which those recommendations were formed. But our research team then also wrote a peer-reviewed academic article based on the findings, which was aimed at a slightly different audience. And we analyzed the ethical reasoning underlying these recommendations made by the public. And that was a challenge because in performing this ethical analysis of the findings, we had to interpret participant statements using jargon that they would probably not have used themselves, and referring to ethical theories that they may not even be aware of. But we really made an effort to closely map our analysis onto what participants were saying to make sure we did not corrupt their views and represented them accurately in our article. Overall, the experience was positive and extremely interesting, although, as was just mentioned, it was a very emotional process. And our team is keen to use deliberative engagement methods in the future.
Thank you very much, Margot. That was brilliant. So hopefully that gives you a bit of a flavour about how public engagement activities have been delivered, but also some of the principles in practice. Before we go to Q&A, and do keep sending the questions through, and I'll come to them in a second, I just want to ask Michelle to reflect a little bit on what she's heard from her colleagues and people she's worked with in the past. Michelle.
Thank you, Kelly. Yes, I just wanted to pick up on 3 reflections which I think make deliberative engagement different to social research. And I know that we'll have a lot of people listening in who have traditionally commissioned social research. So to Amy's point about the insights being helpful because they were an outcome rather than an output, we really did push those 100 people throughout the 4 days of the deliberative process for One London. We enabled them on day 4 to craft some very sensible yet very granular recommendations. And as Amy mentioned, these recommendations I think completely overwhelmed the policymakers and the panelists that we had there that they were presented to and received by on that 4th day. And what this has enabled the health sector to do in London is to use those recommendations and to ensure that where data are being used across our capital, they're being used with the public's expectations in mind, but also where there are red lines that these are being observed as well. And in my opinion, you wouldn't receive that kind of information if you'd have commissioned a straightforward sort of polling, surveys or research of another nature, be it qualitative, for example. Secondly, to Nick's point about the provision of balanced information, and involving organisations like Extinction Rebellion to ensure this, and to Amy's point about people receiving benefits, risks and downsides in order to inform their views. This is different from qualitative research where we could have, for example, used focus groups to explore the public's priorities in relation to climate change for Brighton City Council. But this would have been quite surface level and would have very much relied on their prior knowledge and their prior experience. So you can imagine quite a different outcome there. And finally, Margot's short talk just mentioned the virtual nature of these engagements and making that process more accessible. And I would really echo that and reflect on just how nervous I was taking Deliberation online last March, and we just finished one London, and we had these new studies that were about to start, and we were designing from scratch online, and how I was worried that people wouldn't be able to concentrate, that people would be excluded, that we would have all sorts of tech problems, and quite frankly, those first examples were a complete kind of pilot for us. But what we've learned over the time is that we've been doing it, and we've done a lot online, is that they do enable a more accessible approach for some groups, not all, but for some. And for those who will still struggle with online, we can do lots to enable them to come online, and by setting them up with tech and coaching them through the process. So we do have to sort of tailor our approach and have shorter sessions, but we can do a really effective job online. I just wanted to make that point because I know that people would be nervous or have lots of questions about online engagement. And we can take questions now.
Thanks very much, Michelle. So if I invite the other panelists just to put your cameras back on. Hopefully you haven't disappeared to make a cup of tea. You can pop them all back on again and we will take some questions. So thank you to everybody for sending Q&A in. Please do keep going and add a few more. First question is about the actual question. So a couple of our panelists, when they were talking, mentioned the importance of having a good question to deliberate and engage the public around. What kind of questions are actually suitable for deliberative methods, and are there questions that really aren't? I think, Nick, you talked about being too wide and then coming and focusing in. And this is our very first principle in the toolkit. So would anybody like to start in a response?
I'm happy to start, Kelly, if that's helpful.
I'm going to go first, then we'll bring in Nick. Thanks very much, Amy.
So basically, I think this is really crucial. So deliberation isn't suitable for everything, and it's important, I think, that the questions have an element of complexity to them, that there are some inherent trade-offs that need to be explored, and actually it's a question that the public can genuinely participate in answering. So it can't be too technical. So, you know, I work in the NHS. Some of the information that we deal with is extremely clinical. You know, it wouldn't be fair to expect the public to answer questions like that. So, often I think we need to just make sure that it's something that the public can influence and can genuinely, one that they can then genuinely answer. Recognising that they might need to learn some things through the deliberation process, and that actually it's probably something that might be more complex or controversial, which lends itself more to a deliberative process.
Thanks, Amy. We've had a comment on that into the chat as well, just which is looking at the alternative side of the spectrum, going too wide, but also somebody's commenting that, you know, going too tight with questions can also be quite constraining for members and citizens. Nick, have you any thoughts on that one in particular? So getting that balance.
I think that's right. I think there is a need to get a balance. I think it's a balance between, as you say, not too broad and not too tight, but also something which the engagement process can actually influence, so can make a difference in terms of policy development. We were really conscious that talking about a climate and biodiversity emergency is such a broad topic, and we would have found it very difficult in the time to get down to the specifics, I think, and particularly given that it was an online process, which means that you can't spend a whole day doing things. So the sessions were shorter than they perhaps would have been if they were physical sessions, and that meant that we had to choose a smaller subject, I think, accordingly. And we were really conscious that we wanted, as a City Council, to be able to demonstrate that the recommendations were recommendations that we would meaningfully consider. And therefore, by looking specifically at transport, knowing that we had to review our transport plan and looking at how we can step up reducing the transport emissions from the transport network, seemed like the right balance to strike, and it worked quite well.
Yeah, okay, thanks, Nick. And then Margot, just some of your reflections on the question.
Yeah, so we actually really closely considered how broad or how narrow to make our question when we were designing the study, because if you just asked participants, well, there might be a shortage of ICU beds, what do we do? that's obviously too broad, and it would also puts a lot of pressure on participants because they feel like they have to solve this problem, which, you know, none of us has managed to solve. So they would just go, oh, I don't know. So the way we approach that is to sort of design 4 stereotypical approaches that were in line with approaches that we have seen policymakers make or academics defend, and had them respond to that and think carefully through the implications of taking that approach, the pros and cons. And then once we had those deliberations, they could look back at these 4 approaches and sort of choose on the one they thought was the best one. And it turned out that they actually didn't just choose one approach, but started to combining elements of the different ones to propose their own sort of very original recommendation. So the complexity that that original broad question would have required, we arrived at by starting more narrowly.
Yeah. Thank you for that. So that's principle 1 on questions. Now we have some questions coming through just on the point Michelle was making around online deliberative, and we have a real mix in our examples of sort of the last hurrah with Amy that we were able to do around One London before things shut down in March of last year, and then some of our online deliberation work. And just what does the future hold for deliberation? Michelle, you reflected that online has been possible and it has added opportunities, but as we go into a hybrid working environment, are we happy doing deliberative always online in future? Are we going to be doing a mix? Are we going back to face-to-face? What's your reflection on that? And then I'll come to others in the panel to get their views too.
It's a really good question, and one that we're being asked a lot in invitations to tender, and also when we're having discussions with clients. I think I would say that I can imagine a future where we do both. If you think about involving an entire nation in a deliberation, the amount of time and cost saved on travelling is completely negated by the possibility to do it all online. But if you are going to want to spend much more time with people, to Nick's point, you know, you have a certain limit as to how many sessions people will be willing and able to sit in front of a Zoom screen for. So I think there could be a combination used either within a project or across projects. So maybe, you know, if you're just focusing on a particular place, you might convene face-to-face groups, and workshops would be held in town halls and hotels as we did pre-2020. I think we missed it. I think we missed face-to-face engagement. We missed the interaction that we're able to have with the public. But we also see huge benefits in online for the reasons that I've outlined, but also many others. So I don't know if anybody else wants to comment on that. Amy, you might have some thoughts.
And then I think Nick is.
I think, you know, done both, and I think there's opportunities and limitations with both. So I agree. I think we're probably looking at a model in the future where we do both, depending on the requirements of the project or indeed kind of the topics within that. It's quite interesting. So One London, we still engage with some of the participants. So, you know, they really enjoyed it, and they've, you know, from spending 4 days together and all of like their teas, their coffees, their lunch, you know, they met friends. They're still part of WhatsApp groups now. You know, it's a real community that builds, and it's a real experience for these participants. And I was really worried that when we took that online, that might not have the same impact or the same. And I think it is different, but genuinely, I still think it's a really humbling experience for people to be part of. And that bond is less online, but it still is definitely there. And it's more than I thought it would be. I think, as Michelle said, there are some huge opportunities. So, you know, it's a big investment for any organisation to do, and actually bringing it online does reduce some of the direct costs in some ways. So venue hire, you know, things like that. So that is good. It does mean that you can do more rapid deliberations as well, which might kind of take less time. So there are definitely opportunities. And I think now that we understand how to do it in both physical and online settings, it means that those opportunities are broader, and it just gives us a bit more flexibility.
No worries. Nick or Margot, anything additional to what's already been covered on this one, Nick?
Not really, only really to echo that. I think one of the challenges with online is it is more difficult for those taking part in the process to build relationships with each other, and I think online can get very tiring. So the only thing that I noticed was we did some of our engagement at the weekends, some of it in the evenings during the week, and as you get to about 9 o'clock online, you could see that people were visibly getting tired. And you get less sensing online. So in terms of really sensing how a room feels, that's much more challenging. But there is no doubt that you can reach a different demographic, or you can reach more people more broadly online. So there's benefits with both.
Yeah, and then we had one build on this question just coming through the chat as well about, is the travel and the accommodation cost really negated when there's the other side of doing it online, which involves tech and tech support? Michelle, do you want to pick up on that?
Yeah, absolutely. So it's a really good question. I would say that over the course of 2020 and for this year too, where I've costed the online process, it's probably coming out around the same. So it's not just travel, it's not just the venue hire. You also have to feed people, and like, you know, most venues charge a lot for that. You have to sort of have the whole kind of set up, so you often hire a venue for much longer than it's needed, etc. as well. And some places make you hire for longer than you would necessarily want. But the point is right in that online you are looking at more facilitators. So maybe in a face-to-face group we would have 8 to 10 people per table. Online we're recommending no more than 6. So that means you sometimes have almost equivalent to double the number of facilitators. You need tech people who are on hand to help participants with tech. So if people drop off the line, and those would be separate to the facilitators, but then in a face-to-face environment you'd have runners as well, so maybe that's not an extra cost. And finally, if you offer the opportunity for those who don't have good broadband and laptops or tablets that they can use to supply those, you will have to pay for it. But I think overall it's probably about the same.
Okay, brilliant. Well, I'm going to wrap a couple of questions up together, and then you can choose which one you answer as we go into the last sort of 7 minutes or so of our webinar. But so 2 and then a funny one. One, well, maybe my sense of humour is a bit off, but I think it's hilarious. So advisory boards. Some of you mentioned having advisory or expert sort of checks and balances in your processes, and just, are they necessary? Is that something people need to think about if they're considering going down a deliberative option? And then a question on consensus. How do you get people to reach consensus? Do you need to reach consensus? Does that matter? Are you trying to get consensus? And then a last question, isn't this just a focus group? Question mark. What's different? Sounds very different to me. That's the funny one. So who, take your pick. So those are our questions, and perhaps we haven't started with you, Margot. Will we start with you and let you do a bit of reflection on your advisory? Is that necessary, or consensus, or focus group?
So on the advisory board, so we didn't have a formal advisory board in our project, but we did really see the value of that. So we tried to, as I said, run our materials past external colleagues and experts that we knew, ethical experts, you know, policymakers, just to make sure that the information we were presenting to participants was checked. So we try to, you know, get the value of the advisory board. So I think it's really important to have some external checks.
Yeah. Michelle, do you want to reflect on any of those questions, and then I'll take it to Amy or Nick after?
I can answer the funny one. I've been running focus groups for about 17 years. This is a completely different story. So you have around a 90 minutes with a group of 8 to 10 people in a focus group. You have a set of questions that you are going in there to ask. You are simply asking questions and receiving kind of information back. So it's a sort of an insight gathering exercise, incredibly valuable if you have a set of objectives that speak to that as an appropriate method. Some of the examples of the projects that you've heard today, so the use of data, climate change and a climate strategy, resource allocation, require a lot of information to inform people about benefits, risks, downsides, and also, you know, to be informed by experts who have different positions on different sort of topics, is achievable in a deliberative engagement process and wouldn't be achievable in sort of more traditional qualitative research. And I think that sort of comes to the point around sort of what kind of questions work best for deliberation. It is those more sort of complex, technical, potentially controversial questions which really do lend themselves to this method.
Thanks, Michelle. So Nick, do you want to reflect on any one of those options? I think Michelle's taken the focus group one.
I mean, the advisory board was really important to us because we needed to generate trust. There was a lot of, and there often is a lack of trust in local authorities, and there was a lot of questioning about, you know, when is the council going to come up with a plan to tackle the climate emergency? How are you going to ensure that residents are engaged? And then once we started to communicate that we'd be setting up a climate assembly, how are we going to ensure that it's not going to be biased, etc. And we also felt that the advisory board just really helped council officers to think differently in how we plan and prepare the materials that we gave out to the climate assembly members. And that was an incredible learning experience for us. So we often do things the way we've always done them. So that check and challenge was really helpful. The recommendations, I don't think there was consensus, and I would be surprised if there would be, but we did go through a process of prioritisation, which meant that people were able to accept the recommendations because they'd been prioritised and there'd sort of been a majority view. And I'd agree with Michelle, it's very different from a focus group. And what was so rewarding from a sort of council officer perspective is that the richness of the residents' understanding that was gained through having a detailed process of informing and then deliberating was just really valuable to us. And it sort of prevents a much more sort of knee-jerk reaction, I suppose, which is what we tend to be used to more, which perhaps is where you know, shorter engagement and less deliberative engagement can create.
Thanks, Nick. And then Amy.
So just to add time, so just very quickly, just on the consensus point, I think this is a really interesting point. And in society, we wouldn't have consensus. We don't have consensus. And actually, I think what deliberation aims to do, it asks participants to come in a civic-minded way. It's not to come as an individual with their agendas, but to think of themselves as a member of society. And I think what we're looking for is recommendations or expectations that actually consider how do we all live together, recognizing that we might not all agree. So that might mean a recommendation with certain conditions that everybody can live with. And actually that's incredibly helpful to policymakers and decision makers who are trying to grapple with how one size doesn't fit all. So I don't think it's about consensus, it's about how we can all live with what we're recommending out of this type of process.
Thank you, and thank you all so much for your input today. It's hugely appreciated. I'm sorry we haven't managed to do all of the questions that came through, but we can respond directly over email. I'll get Michelle to do that in their spare time. So look, thank you everybody. Thanks to Michelle, to Amy, to Nick, to Margot, and to all of you for joining us for the webinar today. Please go and look at the toolkit, and thanks to everybody who was consulted in the way, along the way as we produced it. And we look forward to working with you all. Take care. Bye.